Hi, this is Dr. Mark Sehl from the YouTube channel Therapy for the Heart. It's nice to be here. The series of talks comes under the heading, What Makes for a Good Psychotherapy Session? And I named this channel Therapy for the Heart because of the role of emotions that have in our lives and in psychotherapy. Today's talk, the 25th talk in the series, is entitled Are Feelings Good or Bad, Positive or Negative? And in my opinion, their feelings are really the essence of myself and the substance of our lives as a human race. I mean, what's more important than how we feel about things? Emotions are neither good nor bad, positive or negative. They just are. They exist due to us being human and distinguish us from the robotic world that we face every day. Feelings become bad because of judgments we inherit from others early on in life. It is important to cherish our feelings, investigate them, observe them, get into them. It is important to cherish the times we have with our feelings. It is our very substance. It is to me a life-giving force that defines me as separate and different, yet also similar and the same as others. We may numb or divert ourselves by attention to many things in life. Texting, TV, music in the background, obsessions with work, or through drugs, alcohol, and the overuse of prescribed medications. There are many ways to avoid our internal world. I had some of my own use of medications. At some time I was depressed and I was thinking about, I'll try Prozac or Zoloft. I tried it for a while, both of them. Did not like them, primarily because when I used to think about my Aunt Marie, I had very fond memories, feelings, and a little sadness because of that she died. And she died quite some time ago, and I still miss her and feel sad. When on Prozac or Zoloft, I didn't have those feelings. I didn't like that. Medications are good for some people. I just decided that's not my way. I guess if I was really depressed and couldn't function and get out of bed, I would take something. In the New Age era, there was, or perhaps still is, the idea that negative feelings put bad energy into the universe. So don't have bad thoughts, feelings. You know, we carry enough guilt around. People don't need to be made to feel bad just because they are feeling something, and then they have to be responsible for the impact on the universe just for our feelings? No way. Jose. There is a big difference between feelings and actions, but some equate the thought with the deed. I wished someone dead. Coincidentally, they die. Maybe it was my fault because of my wish. Religion plays a role in this too. It's a sin to covet thy neighbor's wife in one's own thoughts. It is the deed. You can go to hell for that in some religions. Here is an example of inherited or induced guilt. The following is a common scene at the dinner table, at least at some dinner tables that I remember and other people have told me about in my practice. A child is not hungry and does not want to eat anymore. I am full, says the child. The child is manipulated by the caregiver and as that person weighs in, no, you're not full. You should be ashamed of yourself. You don't want to eat anymore? People in India are starving. Now the child has to attack the self as being selfish and worries about the people in India. It has enough to be concerned about it getting by day to day. And often the child can't express its feelings of anger at being controlled. It turns the aggression of the caregiver against the self and feels it's wrong. It can't say what it really feels. If it could, that would be mental health if it was invited to say that. But that person would not go on to have the problems that it could have. Notice here that it is not the child who determines whether it is full, it's the caregiver. You are not full. The implication is that the child does not know its own mind. A dangerous precedent. The child does not know its own agency. How is this child going to develop self-confidence? This struggle, if repeated, can turn into an eating disorder with the parent trying to control and the child adolescent trying to find the only way to assert itself, which would be to eat and then throw up. a compromise formation. It pleases the mom or father, but secretly defies the parent. And you can see my talk on perfection in The Black Swan, when I talk about that movie. The dancer has the same compromise. Succeeds with a brilliant performance. Pleasing mother, then kills herself. One of my patients recently said, "I am so negative." I asked, "Did anybody ever say that to you?" And sure enough, she did. Some significant person in her life said that, and said it repeatedly. "You're being negative. You're being negative." Child was expressing her or his feelings about what was happening in the world around them, and they had some legitimate reason to feel the way they were feeling, but they were just being negative. Be positive. A child that has good enough nurturing will have enough positive self-regard that it will eventually have the capacity to think about being generous to people in India. A child repeatedly criticized, shamed will not have that sense of positive self-feeling, and it will learn to repress its feelings or disassociate from feelings in the case of post-traumatic stress disorder. D.W. Winnicott wrote a wonderful paper about the good enough but not perfect parent. Dr. Donald Winnicott was a pediatrician who introduced the concept, the good enough mother, in 1953. Dr. Winnicott recognized the need for children to realize that, quote, "A mother is neither good nor bad nor the product of illusion, but is a separate and independent entity. The good enough mother starts off with an almost complete adaptation to her infant's needs, and as time proceeds, she adapts less and less completely, gradually according to the infant's growing ability to deal with her failure. Her failure to adapt to every need of the child helps them adapt to external realities." In other words, if you completely gratify everything, you wouldn't have development, you wouldn't have maturation. Winnicott's teachings make the point that a good enough mother was better than the perfect mother. This is all to the mothers out there trying to be perfect, and all to the human beings who are trying to be perfect. And I do have a video on there on perfection and on being imperfect. It's very nice to be able to be imperfect, believe me. I'm trying to make this video here. I think I've set it up 3 times so far this morning. I'm not going to do it again. People who are hugely disappointed, not gradually disappointed, often develop 2 extremes of self-regard and self-feeling. I'm better than anyone, or I'm totally incompetent. It is hard to be a mother these days. The stress about how old one gets is getting the many books about how to be the best mother with different points of view. How do you figure it all out? Follow your natural instinct? What is natural anymore? Many of my videos discuss how we inherit self-attacks that in turn lead to other attacks. I work with couples and encourage them to get into therapy so that they can understand what unconscious impulses are inside them before they decide to get pregnant. Mothers and fathers are astounded that, although they promise never to yell at their children, they find themselves just doing that thing after the infant is born. Yelling is a no-no during pregnancy. When a mother is stressed and anxious, high levels of cortisol can lead to high levels in children, and this can in turn result in an increased risk of many mental health problems and many health problems in general, mental health and physical. My experience shows that reasons does not prevail, and couples will fight during pregnancy and in front of newborns. It is more important for them to be right, to win, rather than understand how their partner feels. The answer is to get help. That people can control. Feelings at times can get in our way. Take the feeling of depression. It is not helpful when we are overwhelmed by feelings of sadness, powerlessness, hopelessness, and thus can't get out of bed or function. But depression is also a second cousin to loneliness, another feeling state, and loneliness often means we miss someone. It is a signifier of attachment. Becoming attached often leads to loss and depression. That is part of life. And loving. Personally, I can't say that I like being depressed, but I want to get into it, not avoid it. It brings me to memories difficult to bear, but important to remember, so I don't repeat them, and so I don't repeat what was done to me. When I said I don't like being depressed, that is not entirely true, I must admit. I don't have to admit it, I want to admit it. There is some familiarity with the long-standing depression I experienced and the associated memories of childhood. It is like being back home. But if I could push a button and bring myself back there, I wouldn't want to go, although I miss it at the same time. I don't want that state to continue indefinitely, but I do want to revisit it. It's all right. It is like being back home, and home was terrible, but wasn't that bad either. Feelings of love and hate, disappointment are all intertwined. We can't have one without the other. They come with the territory of loving and being loved. Numbness is another alternative, and at times a necessary protection for the self, but also is not a good long-term solution. I say caregiver in this talk because the early influencer is not only the mother, but it is a woman who carries the child to term, and a lot happens just in that 9 months. I talk in one of the videos about how a newborn can differentiate The Cat in the Hat from other stories because that book was read out loud repeatedly before that child was born. Isn't that fascinating? So here again we see the importance of regulating impulses during pregnancy and beyond. So much transpires before birth. At a conference about 1.5 years ago, I made a suggestion that mental health problems stemmed from the early interaction between mother and child, and the therapist's job was to deal with the anger related to the damage done. That was not my theory, but I put that out there at the appropriate time, I thought, in the conference. And as I did this, after I did that, there was an outcry of women in the audience. Oh, mother is being blamed again. Well, I can understand that in part. On the other hand, there's the difference between blame and responsibility, and accepting responsibility. Spotnitz, he was the one who suggested the term modern psychoanalysis. As you know in the videos, I think it's the third one, I talk about the difference between modern psychoanalysis and classical psychoanalysis. In the seminal paper, The Narcissistic Transference, Spotnitz puts forth the idea that it is the inability of the infant's mother to tolerate the infant's aggression that leads to mental health problems. Quote, the defense seems to originate in a relationship which, at this point, I might want to go back and do the whole video over again, but I'm not going to do it. Quote, the defense seems to originate in a relationship. I'm not like TED Talks, I'm sorry. Quote, the defense seems to originate in a relationship which was gratifying to the infant in some respects, especially in meeting his biological needs for the intake of stimuli, but failed to meet the need of his mental apparatus for cooperation in discharging destructive energy, which infants have. At any rate, the infantile ego, which was not trained to release mobilized, aggressive energy, anger, towards its object, in feelings and language, responded to prolonged periods of frustration by internalizing, taking it into itself, its destructive impulses. That would be what we call a self-attack. Much of the energy that would otherwise have been available for maturational processes was expended to bottle up this impulsivity. End of quote. I find this theory and therapy helpful. So an analyst who feels defensive about being blamed by a patient is not going to be able to hear the patient when it is blaming the therapist for less than adequate treatment. Analysts make mistakes, many along the rocky road of therapy, and they make mistakes when they're delivering videos. As long as they are not big mistakes, they can be repaired if the analyst is willing to recognize the mistake and not blame the patient. That's very important. Often patients are blamed for difficult treatments. In the paper Stalemates in Therapy and the Notion of Gratification, there is a link to this paper, by the way, on the website marksehl.com under Dr. Sehl's bio. You can download it. I describe it, and in that paper I described therapy as a practicing stage where a person can try out heretofore forbidden behaviors, i.e. expressing anger, once a safe environment has been established. And that's important, once a safe environment has been established, because many therapists think that they could try to elicit anger from new patients, and it's not going to happen. You have to really trust that person is not going to throw you out of the office. You have to build up a relationship that where you can really genuinely say what you feel, and not be expelled or not be reprimanded or met with disapproval. So the practicing is done on the therapist before the feelings. We have a good job here. Can be experienced toward the caregiver. And it is a good job, because I do really don't like so much being criticized and anger. It doesn't. But on the other hand, I know it's the best way to go, and I've learned that after many, many years. So I really invite people to be real with me in terms of their feelings of love and hate. That's where they get better and grow and flourish and develop and expand. So yes, it's good when ready to express